So for specialised populations, the high blood pressure question. High blood pressure is when the blood is pumped around the heart, from the heart through the arteries around the body at a higher rate, higher than normal. Can be controlled with medication and regular exercise. High blood pressure can also contribute to heart attack, stroke, kidney failure. And if I was to modify the session, I would probably avoid the push-up test, getting the client pushing up and down. That can cause a bit of stress for them, maybe go dizzy. And I'd also avoid any exercises with their hands above their head or with them hanging below their feet. For lower back pain, I probably would avoid the lower back pain's found predominantly in the lower back. It can cause a lot of pain when doing squats or any kind of core dependent exercises such as a squat. So if I was to put a squat in a session, if I thought it was a good idea, I would get them to use a fit ball against the wall. That would help them keep their shoulders back and their back nice and strong, and use more of their abs rather than their lower back. Also, if they were to be doing a seated row, I'd ask them to use the chest support. Obviously, keep it more isolated into the back, into the upper back, rather than getting them to use. I know they are using their core in the seated row, but it does use a lot of the lower back strength. If they were to have a shoulder injury, obviously the pain is right here in the joint. Could be in the back, but more likely in the joint. A lot of people find the pain if they are putting their arm above their head. So most people can get it to about there. So I'd probably avoid lateral raises also, putting any strain across that shoulder joint. Any shoulder press, a lot of people will find a lot of pain with that as well. And I'd probably work really closely with a physio in getting them the best exercises that I can to help rehabilitate that section.